All right, now the extrinsic innervation of the heart. So again, this can spontaneously depolarize because the SA node, let's say roughly 100 beats a minute, right? People have different resting heart rates. We don't need to get into all that, and that can obviously change the more cardiovascularly fit you are, and there's some genetic potentials there as well, but we'll just get into this. If we want to speed the heart up or slow the heart down, right? It's going at a certain rate, let's say 100 beats per minute or whatever, and we'll slow it down or speed it up. Well, we got two options here. The extrinsic innervation, we can stimulate it from the autonomic nervous system, right? So we can stimulate it with parasympathetic nerves, or we can stimulate it with sympathetic nerves. So parasympathetic nerves, right, are, if you remember from like the autonomic nervous system, parasympathetic is rest and digest, and one of the things it does is it decreases your heart rate, right? Because if you're at rest, you don't need a really high cardiac output, and your heart can chill out. So if we stimulate it with parasympathetic nerves, in this case for the heart, this is going to be, if you remember, the vagus nerve, which is cranial nerve 10, right? Cranial nerve 10, the vagus nerve. So this is going to release acetylcholine. If you remember, acetylcholine on muscarinic receptors on the heart, and acetylcholine will bind to those muscarinic receptors, and they'll make the heart, makes it harder to depolarize it. So it actually won't depolarize as often. So the function is to decrease your heart rate. And there's a fancy word for this, right? Because we're slowing down depolarization. It's called a negative chronotropic effect. So chronos means time. So chronotropic. So it decreases the time. It decreases your heart rate. So it's the fancy word for saying, hey, this is going to decrease your heart rate. So cardiac output goes down. But in reality, when we want to slow the heart down, we're not just stimulating the parasympathetic nerves. We're doing that, but we're also inhibiting sympathetic nerves. So remember, there's two on and off switches. You want the heart to slow down or cardiac output to lower. You're in a rested state. You have to stimulate parasympathetic nerves, so stimulate the vagus nerve, and then inhibit the sympathetic nerves. So you have to do both. So you kind of have to think about that. That's what parasympathetic effect on the heart is, right? So acetylcholine binds the muscarinic receptors, makes it harder to depolarize, so it happens less frequently, which is a slowing of the heart. Now, sympathetic effects. So here we're releasing epinephrine. So release, or norepinephrine, whatever you want to call it, whatever. Norepi, right? N-E, norepinephrine. And this is not only going to bind to the nodal cells, so because parasympathetic nerves affect the nodal cells, this is also going to directly affect the myocardium. Those are two effects we'll talk about. So it's going to speed our heart up. So, well, okay, that's the opposite of parasympathetic. Okay, so positive chronotropic effects. So positive chronotropic effects, which would be increasing your heart rate. Okay, but it's also stimulating the myocardium itself. So we call this, and there's other effects like dromotropic effects, and I won't get into all that. And the other one's positive ionotropic effects. So increasing ionotropic effects increases contractility. So why ions? Just think about it. If ions, make it real simple, if ions move more efficiently, the heart's going to squeeze harder. So the sympathetic nerves don't just make the heart beat faster, it makes it squeeze harder, right? And that's with contractility. We talked about cardiac output, the things that can affect, one, volume of blood being injected, one stroke volume. We think of, one stroke, we think of preload, contractility, and then afterload, which we'll get to that. But this is what it'll do for you, right? So that'll speed the heart up, it'll make it squeeze harder. So squeezing harder is an ionotropic effect, faster is chronotropic. We'll speed that heart rate up. So we always have a balance of these things, right? So again, if you want to speed the heart up, make it squeeze harder, you have to inhibit the parasympathetic nerves, stimulate the sympathetic nerves for this to work, okay? These are the extrinsic innervations and controls in the heart, and these are always working back and forth whether your heart rate needs to go up and down, because you go from just lying down to standing up. You need to have sympathetic stimulation of your heart because of the change in gravity, and you got to make your heart beat faster. You start walking faster, you start exercising, you start getting a sympathetic response due to psychological stress, you start getting anxiety. All of this is going to happen, right? Or if you're in a rested state, your heart's got to calm down, you're sleeping at night. So these are constantly working back and forth together to do that.